Episode 298, Ireland's approach to AI in healthcare.
The primitive forms of artificial intelligence we already have proved very useful.
AI is a golden opportunity.
How do we ensure that this technology is regulated?
The long arc of technological history is now in an extraordinary new phase.
The AI6 podcast with Joanne Sweeney.
HIQA has just launched a public consultation on AI in healthcare, and they've been doing their homework. Hello and welcome back to AI6, the podcast that is helping thousands of people understand AI and in just 6 minutes a day. Because if you commit that time, the compound effort and result is that you are AI fluent. And if you take action on what I recommend in the podcast episodes, then that will help you become AI competent. So, Ireland's Health Information and Quality Authority, HIQA for short, published a 115-page evidence review last week, laying out exactly how Ireland plans to handle AI in health and social care services. It's a detailed framework covering everything from who's responsible when AI gets it wrong, to making sure technology doesn't replace the human side of care. Let's hear from Linda Weir, Deputy Director for Health Information Standards at HIQA. She was speaking to Greg Hughes on Highland Radio. HIQA has called for public submissions on national guidance for what they're calling the responsible and safe use of AI in health and social care. And the timing matters. The EU AI Act is now in force, and many healthcare AI applications fall into the high-risk category, meaning they need serious oversight. So Ireland isn't waiting around. The Department of Health, the Health Service Executive, and HIQA are working together on a system-wide approach, and this consultation is a key part of it. HIQA reviewed 55 international sources, academic research, regulatory frameworks, guidance from bodies like the World Health Organization and the OECD, and they distilled them into 12 themes, and these themes will shape the guidance. Number 1 is transparency. If AI is involved in your care, you should know about it. And this covers explainability. Can the system explain why it made a particular recommendation? It also covers traceability. Can you follow the logic? The guidance calls for auditable AI systems and clear information for patients. They talk about inclusivity and non-discrimination. AI systems, as we know, learn from data. And if that data isn't representative, the outputs will be biased. This theme addresses the risk of AI discriminating against already vulnerable groups. The recommendation: use representative data, make systems accessible, and critically analyse what AI produces rather than accepting it blindly. On privacy, we know that healthcare data is highly sensitive, so this theme reinforces compliance with privacy laws and secure data storage. Nothing revolutionary, but it's fundamental. Then it talks about human agency and oversight. This is a big one for me. Humans must remain in control. The guidance emphasises regular auditing and human validation of AI outputs. AI supports decisions, it doesn't make them. Responsibility is another theme. When AI is involved in care and something goes wrong, who's accountable? This theme tackles that head on. It calls for clarity on individual and organisational responsibilities, accessible redress mechanisms, and human oversight at every stage. On upholding people's rights, they say that AI systems must respect human rights, including autonomy. If you have preference about how AI is used in your care, those should be respected. The guidance recommends considering individual needs and personal preferences and not treating AI deployment as one size fits all. On safe care, the duty to do no harm applies to AI just as it does to any other intervention. This theme covers validation of AI systems before deployment, adherence to regulatory standards, and mitigation of both physical and mental harm. It also acknowledges that AI introduces novel safety considerations that healthcare hasn't dealt with before. And then integration into care. AI shouldn't be bolted on. It needs to fit into existing systems and add genuine value. Education, training, development and information provision. Staff need to know how to use AI tools properly. Patients need to understand what's happening with their care, and this theme calls for continuous professional education and AI literacy for everyone involved, providers and patients alike. On data quality, we know AI is only as good as the data it's trained on, and this theme emphasises consistent, standardised, accurate, complete and reliable data. It also connects to privacy and cybersecurity requirements, per data in, per decisions out. On technical robustness and security, they say that AI systems need to be secure against breaches, attacks and interference. And then the human connection. And this is where HIQA distinguishes itself from purely technical frameworks. Care is fundamentally about human relationships. AI should support it, not diminish it. The guidance calls for person-centred values and involving patients in decisions about how AI is used in their care. So HIQA is asking for your input. If you work in healthcare in Ireland, if you develop AI tools, if you're a patient who'll be affected by these systems, this is your chance to shape the guidance. I've linked the website and the page specifically for the public consultation in the show notes, and the public consultation is open now until the 5th of March. Find out more at www.hiqa.ie. And my friends, if you do work in healthcare, I'd love to have a conversation about what your impressions are about this document, about the public consultation, and about how you would like to see AI being integrated into Ireland's healthcare system. That's it for today. I'm back with more tomorrow.